Hello. If you or a loved one has a condition with your heart or their heart where there's a leakage with the mitral valve or there's some pulmonary insufficiency, I think that you really deserve to hear what this lovely family has to share with you. The possibilities of actually getting the heart to function better, the valves to function better is a possibility, and it's truly astounding. So I'm going to introduce this lovely mother with her daughter. This is Madison and her mom. This is, can I use your first name?
Yeah.
Tracy. And she's got some incredible news to share with you about what one of our treatments for her daughter Madison has done for Madison's heart. And I'll let her take over, and it is really truly amazing. And then after we're done with this discussion, we'll just take a few minutes. After we're done with this discussion, I'm going to move to another video where I describe my unique exam findings and the treatment that we offered her that helped her recover. That is just truly mind-blowing. Okay, so if you could share.
Okay, Madison was born with an atrioventricular septal defect, so that's an AVSD, and it developed until she had subpulmonary stenosis. And at 3 months old, she had to have open heart surgery where they took a piece of the pericardium to make 4 chambers of the heart because she only had 2 chambers of the heart. That was at 3 months. And for the first 2 years, probably, we went to the cardiologist all the time for follow-ups, checking everything. And then she was released to coming back once a year for follow-ups. And every time we would go for a follow-up, they'd say there's nothing there she cannot live with for 100 years. Everything looks good. She had a slight, mild leakage, murmur, and
the leakage from the mitral valve area.
Yes.
But
Slight.
they said everything was fine.
Everything's,
she can live for many years. She never needs surgery. She needs no treatment.
They didn't.
No medicine.
No, they didn't foresee any of that. Yeah. And no, she was not on any heart medicine at all. She was the first year of her life, but not after surgery and full recovery. Okay, well then 6 months ago we went for her regular appointment, and the cardiologist came in and he was very somber, very serious, which was out of character. And
I'm sorry to interrupt. And that was after you had the EKG and an echo done.
Right. They do an EKG and echocardiogram, and the doctor reads it right there, and then he comes in and tells you his findings. And so when he came in, he said that her, her leakage had gone from mild to moderate in the mitral valve, and that he was concerned and that he wanted to see her every 6 months for follow-up so that they could judge the progression and how serious this was going to end up being. And so we talked a little bit. I asked him what I needed to look for symptoms-wise. He said, well, she could get tired more easily when she's doing exercise. Just basically that was it. We'll see you in 6 months. So we went back in February for their EKG again, an echocardiogram. And
that was February of 2022.
2022.
And her original appointment, that was a few months ago, was July. July of 21.
21, yes. Okay. And we saw you in September of 21. And when we came here, I told you what the cardiologist had found, and you said, well, we'll look and see if there's any viruses or anything going on. And you did, and you found, I think it was several different things, and you made remedies for her. And anyway, when we went and they were doing the echocardiogram,
in February of 2022.
Yes, the technician asked me what interventions Madison had done since we had been there 6 months previously. What interventions had been done with her mitral valve. And I said, what are you talking about? And she said, in the cath lab, surely she had some interventions. I said, no, nothing was suggested. And she said, that's interesting. And so I really thought, this is bad. We should have been doing something. They didn't tell us to do it. This is bad. And so we went back into the office waiting for the cardiologist to come in. After he read the EKG and the echocardiogram, he came in and he's just chit-chatting with Madison and talking. And I said, I'm sorry, I have got to know about the heart. What is going on? And he said, well, I don't really know how to explain it, but her leakage has gone from moderate back to mild. And I said, what does that mean? and he said, it's mild, it's not moderate, it's reversed, and I can't explain that. And I said, I don't expect you to remember all of your patients, but when we were here last time, you were very serious, you were very solemn, you were very concerned. And he said, yes, I've read all my notes. And he said that the echo from February did not match how severe it was in July. There was such a significant improvement. And so he said, I really don't know how to explain it, but there's no leakage. There's mild leakage, not the moderate now. And he said there's no swelling in the lower chambers of the heart. Her heart looks healthy. There's no issues. We'll see you in a year. And I said, wait a minute. You said we were going to see you every 6 months. He said, but there's nothing to see. He said, there's nothing to see. He said, her heart is healthy and it is functioning very well. So I was shocked and again said, no, we have to see you in 6 months. He's like, really? There's nothing. And I was shocked. I was shocked because I knew that your remedies could get rid of the viruses and all of that. I knew that, but I just didn't see how that could help the valve to function properly. But it has. It did. I mean, because he said he fully anticipated from his notes that on our February visit he would be sending us to get MRI imaging done and looking towards possible surgery.
And now
So no, don't come back for a year. Everything's good.
Wow.
Yeah. So
And
we thank you.
Thank you.
We thank
You're
you.
welcome.
Yeah.
I appreciate it.
Yeah.
And he was we're going to repeat that. He was literally amazed, like,
He didn't know how to explain it.
how could this
No.
heart get better? How
No.
could this turn around?
Yeah. Yeah. Yeah.
Mhm.
Yes.
Incredible.
And honestly, as soon as I got done, I called your office and I said, okay, let me talk to the doctor.
It worked.
Yes, it
It
worked.
works.
It worked. It worked.
Thank you.
Yeah, thank you.
You're welcome. You're welcome. Is there anything that you want to tell people besides sharing this? And I'm grateful that you're sharing all this amazing information with people and how we were able to work together and help your daughter's heart reverse and become healthier
Yeah.
without going for surgery and without any medications used. And there are
Correct.
no other therapies. It was only this treatment. Is there anything that you can tell people who might be skeptical? Maybe it's too good to be true. Maybe
I
know that-
do
and you
not
tell people
make
all the
any
time.
money.
Yeah.
I do not make any money for telling people what you've done. I do not get, this is not a paid commercial. This is simply, really, it started out, our journey with you started out as desperate parents looking for something to help our children because we had been to so many doctors and so many things and nobody, it was always get prepared for a low quality of life was their answer with our other children. And maybe you aren't at desperate yet, but when you get to desperate, this is where you need to come. Actually, you need to come before you get to desperate, so you don't have to get to desperate.
Sure.
You come before you're desperate.
Yeah.
How's that?
Thank you. Thank you. It is true, and these results are amazing, and you can reverse disease when you have a good doctor, like what I can offer you, when you can have a good doctor who can find the causes of the insufficiencies in the body, of the malfunctions in the body, and provide you a very safe and highly effective strategy, treatment that's going to help you clean up your body, get rid of these different hidden disease-causing infections and toxins. In just another minute, we're going to flip to another video where I'm going to share with you the unique exam findings that I discovered with her, with the treatment that was offered her, that has been able to help her reverse, and her mother and her whole family, help her reverse this moderate to severe heart condition that was going to lead to heart surgery again, and now it's not. And now she's back to normal. You heard it right here. So I look forward to sharing those with you, and I thank you again for sharing this with everybody else out there, and I'll share the next information with you soon.